A monk lifts a clay jar from the infirmary shelf. Inside, dark, amber liquid, honey, old, thick, almost crystallized. He carries it to the patient, a deep cut from a scythe, 3 days old, inflamed at the edges. The surrounding skin is red and swollen. He applies the honey directly. No bandage over it. He leaves it open to the air. By morning, the inflammation has retreated. The wound edges are clean. No sign of the spreading infection that kills so many wounds in this era. Outside, this wound would likely cost the man his hand, possibly his life. Inside, the infirmarian reached for a jar of honey. And a $400 billion industry has spent a century trying to synthesize what was always in that jar. Stay with me. Number 3 is the Monastery flower. A 2013 randomized controlled trial confirmed heals surgical wounds faster than petroleum-based pharmaceutical preparations. Number 6 is the ancient monastery scar protocol confirmed by modern dermatology to reduce scar tissue formation, and it works in 4 weeks. And number 10 is Hildegard von Bingen's complete skin preparation system, documented in 1158. Confirmed by modern dermatological research to address the inflammatory, microbial, and regenerative mechanisms of skin healing simultaneously. Number 1. Raw honey, the monastery's primary wound treatment. Every monastery maintained hives. Not primarily for sweetener. For the infirmary, raw, unprocessed honey is one of the most complex, naturally occurring antimicrobial substances in modern microbiology, containing hydrogen peroxide, methylglyoxal, with broad-spectrum antibacterial activity, including against MRSA, B defensin 1, and a low-water activity that physically prevents bacterial growth. Honey maintains the moist wound environment, accelerating epithelial cell migration. Its acidic pH inhibits metalloproteinase enzymes that degrade the collagen framework. Its anti-inflammatory properties reduce the signaling that delays healing. Medical-grade honey is now an approved wound care treatment in hospitals across Europe and Australia. Honey-treated wounds heal faster, with lower infection rates and less scarring than standard pharmaceutical preparations. Number 2. Calendula, the infirmary's skin repair flower. Calendula officinalis was the primary topical skin treatment in the Benedictine, Franciscan, and Cistercian traditions. Monastery records document it for wounds, burns, skin inflammation, fungal conditions, and the slow-healing ulcers of elderly monks. Calendula contains oleanolic acid glycosides with anti-inflammatory effects, flavonoids, reducing inflammatory cytokines, polysaccharides stimulating fibroblast proliferation, and triterpenoids accelerating granulation tissue formation. A 2013 trial found calendula healed post-surgical wounds significantly faster than petroleum-based standard wound care. A 2009 trial found it outperformed the pharmaceutical standard for radiation dermatitis. Modern skincare sells calendula extracts for $40 to $80 per jar. The monastery grew it for nothing. Number 3. Lavender oil, the antimicrobial and scar prevention agent. The monastery produced lavender oil as a standard apothecary product, used for infected skin and applied to healing wounds in later recovery stages to prevent scar formation. Lavender oil contains linalool and linalool acetate, inhibiting TGF-beta signaling that promotes collagen overproduction in healing skin. Excessive TGF-beta produces the dense collagen deposits we recognize as scars. A 2016 study in Phytomedicine confirmed lavender oil significantly reduced scar formation by inhibiting TGF-beta signaling and myofibroblast activity. Number 4. Plantain leaf, the common wound herb nobody respects. Plantigo major. Broadleaf plantain, the plant that grows through cracks in every pavement. The most universally documented wound herb in the medieval monastery tradition across Europe, not because of rarity or cost, but because of consistency of effect. Monastery records across England, France, and Germany document plantain for cuts, abrasions, skin inflammation, and infected wounds of agricultural labor. Plantain contains occubine with anti-inflammatory and wound-healing properties, allantoin stimulating cell proliferation. The same compound pharmaceutical wound preparations add artificially, and mucilage, maintaining the moist wound environment. Epithelial cell migration requires. A 2012 review confirmed its wound healing, anti-inflammatory, and antimicrobial effects. The plant costs nothing. It grows everywhere. Number 5. Apple cider vinegar, the monastery's skin pH restorer. The monastery cellar produced apple cider vinegar. Used topically for skin conditions the modern world treats with antifungal pharmaceutical preparations. The healthy skin surface maintains pH between 4.5 and 5.5. Commercial soaps and cleansers routinely disrupt this acid mantle, making skin vulnerable to exactly the conditions they claim to treat. Raw apple cider vinegar, diluted appropriately, restores this pH environment and contains acetic acid that directly inhibits Candida, Staphylococcus, and Streptococcus, the organisms responsible for the most common skin infections. A 2019 study confirmed acetic acid solutions significantly inhibited dermatological pathogens at dilutions compatible with safe topical application. This is the moment to pause. 5 skin remedies, all from the monastery garden, cellar, or apiary. All confirmed by modern dermatological research. The global skincare market exceeds $500 billion, built largely on selling back the healing mechanisms the monastery performed with garden plants 700 years ago. Leave a comment right now. Tell me which of these you have already used on your skin. Number 6. Rosehip oil, the 4-week scar protocol. This is number 6. The one that reduces scars in 4 weeks. Rosa canina, dog rose. The wild rose hips collected in monastery gardens every autumn, their seeds pressed to produce a deep orange oil applied specifically to healing wounds and existing scars. Rosehip oil contains trans-retinoic acid, a natural form of vitamin A, that is the active compound in tretinoin, prescribed for scar reduction and skin aging. It also contains extraordinarily high vitamin C concentrations, the essential cofactor for collagen synthesis and essential fatty acids, required for healthy skin barrier function. A 2015 randomized double-blind trial found rosehip oil significantly improved scar appearance, skin tone, and moisture over 4 weeks, statistically significant improvements in all skin quality parameters. The pharmaceutical retinoid cream, containing a synthetic version of the same compound, costs approximately $80 per tube. The monastery collected rosehips from its own hedgerows for nothing. Number 7. Oat and honey preparation, the eczema and inflammatory skin protocol. In monastery infirmaries, treating what records describe as heat of the skin and itching of the flesh, conditions we now identify as eczema, oats and honey appeared consistently. Colloidal oats contain avenanthramides, polyphenols unique to oats that specifically inhibit the NF-κB inflammatory pathway in skin cells, reducing the histamine response, causing itching, and the cytokine production, damaging skin barrier function. The FDA has approved colloidal oatmeal as an active ingredient in eczema treatment. A regulatory recognition of efficacy the monastery was documenting 1,000 years ago. Combined with honey's antimicrobial properties, this preparation addressed both the inflammatory and barrier dimensions of chronic skin inflammation simultaneously. Number 8. Comfrey, the deep tissue repair herb. Symphytum officinale. Comfrey, documented in monastery infirmary records. For wounds that will not close and deep tissue damage, comfrey contains allantoin. in concentrations higher than any other commonly used medicinal plant, stimulating cell proliferation in both epidermis and connective tissue simultaneously. It also contains rosmarinic acid with potent anti-inflammatory effects. A 2012 double-blind trial confirmed comfrey root extract cream significantly accelerated wound healing, reducing wound area and inflammation more rapidly than standard care. Note: comfrey is used externally. The internal use of comfrey requires caution due to alkaloid content. Only external topical application is documented in Monastery records and clinically confirmed. Number 9. Turmeric paste, the Monastery skin anti-inflammatory. The Monastery hospitals of India documented one preparation for skin inflammation above all others: turmeric paste applied directly to inflamed, infected, or damaged skin. Curcumin inhibits NF-κB in skin cells, reduces the inflammatory cascade damaging skin barrier function, and demonstrates direct antimicrobial activity. A 2016 systematic review confirmed curcumin promotes wound healing through reducing inflammation, stimulating collagen deposition, and supporting angiogenesis. Number 10. Hildegard's Skin Protocol, the 1158 formula in Physica, written around 1158. Hildegard von Bingen described skin preparations for wounds requiring closure, inflammatory skin requiring cooling, and aged skin requiring nourishment, 3 categories anticipating modern dermatological practice. For wounds, honey, beeswax, herbal infusions; for inflammation, calendula and plantain; for aged skin, rose preparations and herbal oils combining retinoid precursors and anti-inflammatory phenolics. A 2020 phytochemical review confirmed each category contained compounds specifically relevant to its targeted condition. 860 years before modern dermatology existed, they built a $500 billion skincare industry on skin damage. The Monastery herb garden, apiary, and kitchen naturally prevented and healed on the antibiotic-resistant bacteria that honey's multi-mechanism approach bypasses, on the scar formation that rosehip oil's natural retinoids prevent, on the chronic inflammation that calendula, oats, and plantain address at zero cost, on the pH disruption that apple cider vinegar restores immediately. A clay jar of honey, a garden of calendula and plantain, rosehips from the hedge, lavender oil from the still. With these, the Monastery managed skin conditions that the modern world treats with expensive pharmaceutical formulations. Share this with someone whose skin has a wound or condition that standard treatment has not resolved.